So the key is getting everybody vaccinated as quickly as we can. I have always been, for the last couple of months, probably, certainly, or at least for the last month, I've been very concerned as I look at data that is reported publicly that show that Pierce County, as a percent of population vaccinated, is lagging behind kind of the state and behind our neighboring counties. The county council chair and I sent a letter off to the governor and the secretary of health a week ago Monday, highlighting our concerns and that we expected to get kind of made whole and get our numbers back up. I followed up with the increasing case rates and the fact that ours are increasing kind of somewhat sharply and more sharply than kind of King and Snohomish. We followed up with the governor's staff and asked them if they had a response coming. And I was concerned because our staff got a text from the governor's staff that said, for the last 3 weeks, we've offered Pierce County additional vaccine to help catch up on a pro rata, and all that we offered have not been accepted. DOH going to speak with Anthony tomorrow. So obviously that's concerning if we're not accepting all the vaccines. I would believe that, I don't believe that's the case. And I believe that we've got more than enough capacity to make sure that any amount of vaccines we can get into Pierce County, we can get into the arms of the people of Pierce County, protecting them. And that's my understanding, is we've got that and we can ramp up whatever we need. Nigel, I know you've been looking into that. Is this a miscommunication?
Thank you, Executive Damar. Yes, we have been looking into this extensively since we were made aware of this last night. You're absolutely right. We have made every attempt to get as much vaccine as we can for Pierce County and take advantage of the capacity that's available and that we're planning for. We've been in correspondence with DOH today to find out where that statement came from. You know, I think it's important to understand that, you know, sometimes we hear of instances where vaccines offered very late, but even in those instances, we're able to find homes for it in Pierce County. Remember, not all Pierce County providers who are signed up and eligible for vaccines received any vaccine. So at very least, we'd say get it to those providers that haven't had it yet. So I think that's something that it's just not true from our end. We're trying to learn from where it came from. But bottom line, we are absolutely making sure we get as much vaccine as we can, and we have the capacity in place to use it now and expand into the future.
Good. Thank you very much for that work. When I look at the Department of Health's website, even today, I was looking at it over the weekend, even today, it is showing Pierce County as a percent of population vaccinated that we're 5 percentage points behind the state average and 8.5 percentage points behind King County, and behind all of our neighboring counties except for Lewis County. So we've got to get this made up. This is absolutely essential. When you think about, you know, if we had the same percentage vaccinated as King County right now, that would be an additional 75,000 people in Pierce County vaccinated. So if there's anything I can do, we've got to get up to the average or better. We just can't, particularly when as right now, we're seeing case rates increasing. We're facing the prospect of rolling back, and it is very difficult to face the prospect of rolling our community back into some significant restrictions when we're behind our neighboring counties significantly in getting vaccine into the arms of the people of Pierce County. So if there's anything we can do, I can do, I'm sure the rest of the health board would be with us in this is job one, to get the people of Pierce County vaccinated. Thank you, Mr. Chair.
Well, Board Member Demeyer, you know, I just want to emphasize that this rumor that we're turning down a vaccine is absolutely false. You know, when we heard that from Ken Farmer, I mean, every person that email said news to me, and literally those were the words. You know, Stephanie can fill you in on some of the details, and we've also been keeping Dr. Farmer up to speed on why there are discrepancies in the numbers. And so I want to turn it over to Stephanie, because this is an area that the public, it's very difficult for the public as they're hopping from website to website trying to figure this out, but it really doesn't tell the story of the work, the great work that emergency management and the health department's doing. So Stephanie, I know you have spent some time trying to explain this. Can you just talk about the second part there about the discrepancies in numbers?
Certainly, yeah. So I appreciate and first want to echo, we feel the same way and we want to see those numbers. So over the last several weeks, we've been digging into this, but specifically also hearing from Dr. Farmer as well last night. Had a little bit more conversation today with our state partners. We did early on, about mid-March, get notice from our state partners that we were under pro rata for maybe an error in pro rata allocation for us at the state level. That was immediately corrected by our state partners. And so since mid-March, we've been receiving the appropriate weekly pro rata foundation. But what that meant is historically, we've had a pro rata that we've been under. So what we have asked today is that difference in historical pro rata allocation that was made in error by the state partners, just in the complexities of this work, they've been very transparent with us on that front. So I just want to honor that they came forward and made that commitment to us to make a change. We're asking that we understand how much of a difference we could have received in those weeks and that those be added to our coming weeks of allocation. We haven't heard back yet if that's possible, but that is something we are looking and asking, that instead of waiting till Thursday or Friday for additional doses, we proactively receive what historically we would have received in those few weeks that maybe that error was made. So we're digging into that and can certainly follow up with board members about where we land in the coming days, and are expecting some calls from DOH leadership today. It is a very complex allocation process. I don't necessarily envy them in that. When it looks at prior to 3 weeks ago, it wasn't necessarily pro rata and a consistent 3-week allocation. So there were definitely some complexities, but they approached us right away, made the correction, and are going to continue to do that with us. So more to come, and I can share more with